I'm going to go to you first, Keith. Because obviously, I don't know if you know Rudy, but way back in the day, Keith had a prostate scare. Many people do. I would say that 90% of men, not just guys, like you guys and your patients and stuff, but just 90% of men at some point in their life have a PSA elevation, right?
Yeah.
Or something, and they get freaked out by their doctor or whoever it is that says, this could be early onset or whatever. So Keith, you want to share your story a little bit before we get deep into this?
Oh yeah, we'll make that real quick. Yeah, it was, gosh, I don't know how many years ago. It's been maybe 8-9 years ago. But I was having a prostate MRI done just to do the research on my own. I had a normal PSA at that time, but in an effort to do what I always say I do for my patients, I'm experienced firsthand. So I was going to go get a prostate MRI to see what it all involved. So I actually did that, and he found 2 lesions on the prostate, fairly large lesions.
Wow.
And so he diagnosed at that time with prostate cancer. And Angie and I were just visiting Chattanooga at the time, and that was where one of the leading radiologists in the country was, and he still is, but he's in Atlanta now. But bottom line, we walked in, planning on going to dinner that evening and having a good time. And next thing you know, we walk out the door, and I've got
it's over.
We're standing there in front of a screen, and they're going over all the screens. And the fact is, I've got these 2 large prostate cancers. And so, what do you do then? So we're shocked. And so for what you do then, once you get a diagnosis like that, is you're then going to have a biopsy. And of course, I was going to have a targeted biopsy, meaning that you have to come back, get another MRI, and they'll guide the needle straight into those lesions they saw. So we scheduled that for about 3 weeks after that, as soon as we could get it. And so we come back in 3 weeks later. So I lived there for 3 weeks with prostate cancer. Let me tell you,
unbelievable.
Anybody that tells you that, you wake up and the sky is blue or the grass is greener, that's BS.
That's right.
I have the utmost respect for anybody that gets a diagnosis and what they live with every day, because you literally go to bed and you dream that it's a dream.
Yeah.
And then you wake up, and for a fleeting few seconds, you're like, man, that was all a dream. I don't have cancer. Then in a matter of seconds later, I've got cancer.
Wow. And
it is truly devastating. So, my hat's off to anybody that's had that diagnosis. So I had that diagnosis for 3 weeks. So I do know what it feels like. So we went back to get the biopsy, went in, and just got a strange sensation when I went in. And he said, well, look, before we do the biopsy, we're going to put you back in the scanner, do a few more images. And I looked at the tech, and I'm like, is this common? It's the first time I ever had it. And he kind of shook his head. I could tell that wasn't normal. And so I went in there, and I can just remember shaking in that MRI because, you're there, you got cancer.
Yeah.
Take some more images, and we're going to do a biopsy and have to deal with it. And so they pull me out of the scanner, pull Angie and I into the radiologist reading suite, and he sits us down. And he goes, look, I thought there was something wrong, so I had to pull you in for some more images, with my trusted machine. He says, look, whenever you had your first MRI, that was a brand new machine, first day in use. He said, I tried to tell him that it wasn't calibrated yet, but it was the first day in use. And he goes, you and 2 other guys.
Fucking unbelievable.
Oh my God.
He goes, I've now re-imaged you with the machine that's well calibrated, and there's no prostate cancer.
Jesus Christ.
Oh my God.
So,
wow.
So that gave me, talk about appreciation for something. So of course, you have an interest in all men with prostate cancer. Of course, I'm at high risk because of family history. And I know that. That's why I do get an MRI every year. So I do have a special interest for those men out there that are at high risk and they think that testosterone is dangerous, so they're on active surveillance. So that's a big part of my practice is dealing with men with prostate cancer or high risk for prostate cancer on active surveillance.